Good afternoon and welcome. This is Diplomatic Passport, your daily COVID-19 update show brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. I'm Blessing Munatsi. Let's start by giving you the latest figures released by the Ministry of Health and Childcare. Zimbabwe recorded 25 deaths and 425 new cases of COVID-19 yesterday. This brings the total number of active cases to 15,480. And the cumulative number of cases now stands at 121,498. Of these, 101,837 are recoveries, while deaths stand at 4,181. Zimbabwe currently has 437 hospitalized cases of COVID-19. Of these, 38 are new admissions, 93 being asymptomatic, while 274 are mild to moderate cases. 40 of those admitted have severe symptoms, while 30 are in the intensive care unit. Let's look at figures around Zimbabwe's vaccination program, which is still ongoing. As of the latest data, 47,809 people have received their first dose by the end of yesterday, and brings the cumulative for the first dose to 2,193,346, while 43,572 have received their second dose, bringing the cumulative for the second dose to 1,348,374 people. Now, there has been a high demand for the vaccines, resulting in long queues at vaccination centers. However, there have been concerns raised on the flexibility of the program, especially in circumstances where a person wishes to have their second COVID-19 jab at a different health facility from where they received their first dose. In some instances, there have been reports of people being turned away, or rather referred to centers where they received their first dose like this. And we caught up with this woman who shared her experience.
Dati vanga vachitikana munhu wakabairwa kana tukumushoko yapanapa makuseni vaisokudza kwato tukuma vanoti mamufanira kubairwa panapa mufanira kudzokera kwamakabairwa jekiseni. Saka ndozvachinetsa vanhu vazhinji vanga vachinge vachidzokera kumba.
So what is the official position when it comes to this? Well, the Deputy Minister of Health and Childcare, Dr. John Mangwiro, has clarified this issue during a tour of local clinics in Harare, where he was assessing the vaccination program together with a UNICEF country representative. He said in no case should anyone be turned away from receiving their COVID-19 jabs. He also gave insight on how the government is readjusting its systems in order to fast-track the vaccination process. And as part of this initiative, he did highlight on their community engagement program, in which they have engaged the youth to offer data capturing services at the COVID-19 vaccination centers.
Other places there was lots of misunderstanding, but we want to repeat that there is no need for any clinic or outlet or hospital or a person to send away anybody to say there's no second dose for Sinovac or Sinopharm vaccine. If a patient comes or a person comes, they must get their first or second dose at the time they need it. We can't tell them to go away. Secondly, if someone comes from Kariba to Mfakose here, they must be given their second dose at Mfakose. We don't want sending away people to say you were injected in Mutare, go back to Mutare. That's not it. We have plenty of vaccines, so nobody should be sent away. And what we have also seen, there were a bit of bottlenecks in the clinics. We have made sure that we increase the number of data capturing, leaving nurses to do the actual technical work of injecting patients. We have put in place people from the community, the young ones. They are doing the data capturing, filling in the cards so that the program moves. The queues we are seeing, we want this to become a thing of the past. We want people to be served efficiently and quickly.
Well, with the vaccination daily doses increasing, almost doubling over the past 2 weeks, Zimbabwe's mass vaccination campaign is proving to be a success, as seen by the turnout also at vaccination centers by seeking people seeking to get their COVID-19 doses. This has, however, led to congestion at some of these healthcare centers, which has seen some people being turned away and asked to come back the following day, possibly. UNICEF Zimbabwe country representative Dr. Tajudeen Oyewale said they are working with the Ministry of Health to capacitate health institutions with human resources in order to handle the administration and also clerical work that is involved with the vaccination program, and leaving nurses to administer vaccines so as to try and pace up the vaccination process.
On the vaccination, we all know that Zimbabwe is ramping up aggressively on the COVID vaccination. The minister and I took time to look at the work process for the vaccination in this clinic to try and see areas where we can have efficiency gains. For example, we discussed options on having nurses do the actual vaccination and look for some other clerical staff to help with documentation as a way to save time. We might also look into some Android apps that can also help to make the registration and enrollment faster for the vaccination. Lastly, I'm very happy that the minister has clarified that anyone can come from anywhere to any center to obtain the vaccine, whether for the first or the second dose vaccination. That will help to expand the coverage of the vaccination program in the country. As UNICEF, we're very happy to see that things are moving. We acknowledge that more has to be done, but I think we are on the right footing in getting things to move. I believe that together, not only for vaccination, but also for healthcare services for mothers and children, we can do more and save more lives in this country.
So there you have it. Go and get your jab today if you haven't received your COVID-19 vaccination as of yet. Nothing to fear, and definitely nothing to be skeptical about. That's all we have for you today on Diplomatic Passport, a show brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. We are back again tomorrow, same time, same place. Until then, it's bye-bye for now.